Kebbi and Plateau states are two states in Nigeria with very rich tourism attraction and agricultural productivity. However, both states have high unmet needs for family planning. To address this, EngenderHealth, with funding from the Catalytic Opportunity Fund, and leadership and support from the Ministries of Health at the federal and state levels, implemented the second phase of the Hormonal IUD Scale-Up project in Kebbi and Plateau states from August 2024 to March 2025.
Our selection of Plateau and Kebbi states are basically on one, the unmet family planning need as reflected in both states, captured in the national NDHIS survey, and secondly, both states, that's both Kebbi and Plateau states, have a very low number of healthcare workers that have been trained and are proficient in hormonal IUD service provision. We worked through the office of the State Family Planning Coordinator at the State Primary Healthcare Development Agency in both states, and I'm the State Ministry of Health in mapping local governments for the intervention, as well as identifying providers for the training on hormonal IUD service provision. So we have 23 providers selected each from both states, giving us a total of 46. These providers were brought in and trained for 4 days, 2 days of didactic and 2 days of clinical, using the Federal Ministry of Health approved training manual on hormonal IUD scale-up in Nigeria, as well as also assessing their competency using still the Federal Ministry of Health competency-based checklist.
We are only 4 people that normally insert hormonal IUD in our LGS, and the number of insertions was about 43 insertions. When the EngenderHealth came to Kebbi for their project, so they were able to train about 17 LGS, and these 17 LGS, we have about 23 providers that were trained. So they changed the narrative of insertion. After the 23 providers were trained, they were able to go back and cascade the training to their core members.
Before the intervention of EngenderHealth, it's not as if there's little awareness about hormonal IUD, and in particular, the awareness is is not significant, and I think where you can access that commodity is the Jos University Teaching Hospital, but for the states, it wasn't anything that we have providers who can insert. But when EngenderHealth came, that is in 2024, sometimes around August in 2024, they came with this intervention. The intervention was on capacity building on hormonal IUD, where participants were drawn from the state primary health care, and a total of about 23 providers, both from the local government and then from the secondary facilities, were invited for this training.
With support from the state-based master trainers and the expert trainers within that vicinity, we deployed back the providers to their facilities to begin to offer services with support from the master trainers, who goes into the facility to provide periodic supportive supervision and follow-up coaching until they attain competency. And as part of the training process, each of the providers that were trained are meant to go back to their facilities and cascade down the training to 5 other providers within their locality, within their facility or the locality where their facility is based.
And after the training, we see that they are okay. They are trained. They knew what they are doing, and we still follow them to their facility. When I got there, I tried to see what the champion were doing, the way she was trained their cohort member. Some of times I used to meet them with the clients, because I used to ask them to organize the clients before my arrival. So the community mobilizer will do that, and they do insert in my presence.
The Federal Ministry of Health actually ensure that the national curriculum that has been developed for CHAI was used for the training, and in fact they were also part of the training to ensure quality assurance and compliance with standards. So that's one key part of it. And then another part was the issue of data. One key challenge is people have been using family planning, but sometimes they are not really captured to a platform. So there has been that strong oversight on that to ensure that uptake of these services are captured in CHAI too. And then as part of the post-training support, Federal Ministry of Health was also involved in the supportive supervision of services provided after the training of these providers, just to ensure quality services.
These interventions have no doubt improved access to FP services in both states.
For 2024, before the training, we could say we had like only 5 before the training insertions done. But after the training, that's between August and December, we have over 100 insertions between August and December 2024.
Before EngenderHealth came, the uptake was not all that okay. I can say 3, 2, but recently I can tell you that in a month we have up to 20, 16, 17.
Without EngenderHealth, I would say that places like Panshin, Shendam, Mongo and others will not be able to offer hormonal IUDs. As I have said earlier on, hormonal IUD was only restricted to Jude, just University Teaching Hospital. And even to get to Jude, it was only those that are well-to-do that can offer, that can obtain that services. But now people are rushing. Actually, people are now going for hormonal IUD with what I have just seen within these 5 months that EngenderHealth came to Plateau State.
So from August that Engender trained people for hormonal insertions, we were able to insert about 1,200 of insertions of hormonal IUD to January. So with this project, we were able to have many insertions.
Clients who have accessed HIUD services also talk about their experiences.
Na yanke shawarar sa roba saboda dalilin zubar jini yasa. Akwai wata aminiya ta makwabciya ta kuma zaman antina take. To ko da ma ita tana sa wannan roba. To bayan kwanakin baya can na je wurin ta sai ta ka faɗa min cewa ai roba ba ta da matsala. Sannan kuma in ta buƙaci haihuwa duk lokacin da ta cire ta tana samun juna biyu lokacin da ta kasu. Babu wani matsala zubar jini ko wani matsalar ciwon mara. To bayan na shigo nan kuma sai asibiti MCH na shiga, sai shugaban wurin ta MCH na ta ɗaukar filanin sai ta ka faɗa min cewa akwai roban mahaifa da aka sawa, babu wani matsala gare ta, tana da kyau sosai. Da gare shi na sai na yanke shawarar sa roban mahaifa. Da ina tunanin akwai matsala in an sa roba, tunda ta yadda an ka ce ana sa roban ma na ɗan ji tsoro. Amma bayan kuma na sa kuma sai na ga ai babu wata matsala, ban fuskanci ni ko wace matsala ba game da sa roba. Ina ba 'yan uwana mata shawara game da roban mahaifa, su yi ƙoƙari su sa roba mahaifa don ban ga wani illa ko wani matsala gare shi ba.
Mun je primary health care na Mango, mun kai yaro rigakafi, sai su nurses kamar ita Mrs. Felicia Labi, ita ne tana ba mu wannan shawaran da cewa mu yi. Sai na zo na faɗa ma mai gidana, sai ya ce in je yi. Da na yi kuma ban samu wani illa a jiki ba, na yi shi kuma na ji am okay, ba damuwa. Abin da ya sa na yi don spacing yara. Da na yi HIUD ban samu matsala ba, mai gidana ma bai complain ba, ya ji daɗi, ni ma na ji daɗi. Shawarar da zan ba ma mata shine kada su ji tsoro ba, domin yayin da ni na ji daɗi kuma ya taimake ni, ba wani illa ciki.
There is indeed no doubt that the HIUD scale-up project implemented by the EngenderHealth in Kebbi and Plateau states has made significant contribution to increase access to modern contraceptive, which in turn would help to improve the quality of lives and well-being of the women in both states. Stakeholders are optimistic about sustaining the gains of the project.
For sustainability, for each of the facilities, we have 6 trained providers that are competent in providing hormonal IUD service provision. So that will help address the issue of staff attrition, where 1 or 2 persons are transferred out of the facility and the skills goes with them. So in this situation, yes, when we have 1 or 2 transfers from within the facility, you still have about 3 or 4 persons that are left within the facility to continue with the service provision. And one very interesting area where the state had actually come out to push for sustainability is in the area of budgetary allocation and release. So what we've been able to do is that we've engaged with all key stakeholders, from the Department of the Family Planning Coordinator up to the Commissioner, and we've been able to get commitments for budget release as far as family planning is concerned.
With this insertion and the number of achievement gotten from the insertion of hormonal IUD, we are able to discuss this with our Commissioner, and he said that he is going to link us with the First Lady so that the provision of FP services will be more in Kebbi, so they will be able to support us with the line of budget of our family planning. So people will be continue to have access to these hormonal IUD insertions. I know that inshallah it will not stop, and the mentoring and supervision will continue.
Recently, just about 2-3 days back, the ES had asked us that we should write a memo for procurement of family planning commodities, and then we're going to procure family planning commodities, and then the hormonal IUD is going to be included in it. So the state or the government of Plateau State is making preparation at least to see that family planning commodities, including hormonal IUD, is available even for our women, aside from what the national used to give us.